Okay, as people start to come in and get seated, I wanted to welcome you all to the lecture hall. I'm glad you found us all the way down the hallway and hope you enjoyed that morning keynote. We have another great session. We have some great speakers. And our sponsor, Eric Buxton with Applied Drug Development at the School of Pharmacy, UW-Madison, is going to come up, introduce our speakers, and say a few words.
All right, thank you, Macy. As she said, I'm Eric Buxton. I'm a clinical professor in the School of Pharmacy, and we are proud to support BioForward and sponsor this morning's session. We support its mission of growing the biotech industry across the state and region. To that end, we have offered non-credit professional development designed to upskill the workforce. For the past 5 years, we've offered an MS in applied drug development, and to that end, we are having a degree of success placing our students in local companies. We hope to help the workforce grow for years to come. So, Wendy, I will turn this over to you, but hope you enjoy this session.
Great. I thought they were going to leave me up here by myself for a minute there. So welcome, everyone. Thank you for coming. We are going to talk a little bit more about the Biohealth Tech Hub. So as all of you know, we are very excited to be the recipient. Come on. They do really want to leave me here by myself. You got to have your mics on? All right, good. Good. Okay, hold on. Did we just skip to that? Okay. Great. So thank you for joining us. We are going to talk about the Tech Hub. We're going to make this as conversational as possible here. So I'm Wendy Harris, for those of you that I haven't met yet. My background, electrical engineer for GE Healthcare for many, many years, 32 and a half to be exact. And then I had the opportunity to get engaged with the Tech Hub last year, kind of put together the proposal. You're going to hear about how we did that, how we put together a proposal. From my great panel here, we're going to talk about, we've got Grace Klein. Grace, if you can introduce yourself.
Hi, I'm Grace Klein, Program Officer with the U.S. Economic Development Administration, a bureau with the Department of Commerce. If you were here yesterday and heard the opening remarks from the Economic Development Administration, or EDA's Acting Assistant Secretary, Christina Killingsworth, I work with her, and I'll talk more about the Tech Hubs program. But basically, in short, competitive grant program, a new program at the federal government level, and the Wisconsin Biohealth Tech Hub is one of our awardees. So exciting
Your best
times.
awardee.
Not allowed to say that.
Yeah. She can't say that.
You can say that. But yeah, I'll pass to you all.
Thanks. Mark Thomas, I'm the Chief Strategy Officer at Madison College, and I lead, you'll hear there's a number of different projects that make up the Wisconsin Biohealth Tech Hub. There's a workforce project, and so I lead that project with my colleague, Idella.
And I'm Idella Kangas. I'm with the Universities of Wisconsin. I'm Director of the Office of Economic and Employer Engagement at System. And we can talk a lot about what we did to sort of build this collaborative workforce project.
Great. So thank you again for joining us. So we're going to start with Grace, talking a little bit about the Tech Hub program from an EDA perspective. And so I'll turn it over to Grace and we'll get started with the slides. Do you want me to click them or do you want to?
Sure, thanks. Okay, so Tech Hubs program, new program run by the Department of Commerce, and again, the Economic Development Administration, a small bureau in commerce. This is one of many new industrial policy, new spending programs that have been passed in recent years, in addition to those under the Infrastructure Act, the Inflation Reduction Act. So there's thousands of people like me who have been hired into the government, and hundreds, if not thousands, new grantees like Wisconsin. And hopefully this is setting the stage for what will be ongoing funding in programs like these. We're funded under the CHIPS and Science Act, passed in 2022, and this competitive grant program is all about investing in regions across the country that already have an agglomeration of assets, researchers, companies large and small that are building momentum in a critical technology area. And the idea is with some federal funding, this can be like a catalyst for strategic coordination among those partners in the region, and overall national security benefits and economic benefits, not just for the regions, but for the country at large. And then, of course, there's a whole jobs aspect of it, right? As you're supporting workforce developers, which you'll talk about, and growing companies, we can help ensure that job growth and job retention remains in these regions. Last thing I'll say about the mission of the program is over the past 10, 15 years, growth in tech industries has really happened in the places you're familiar with, your San Francisco's, Boston's, New York's, Austin's, but there's plenty of places like Milwaukee and Madison that are tech hubs in their own right, and we want to shine a spotlight on those places. So we ran this as a 2-phase competition, and in the first phase we got almost 200 applications from regions across the country who told us about the momentum already happening in their regions. And then we designated 31 of them, including Milwaukee and Madison, as official US tech hubs. And then that designation was a green light for them to apply for strategic implementation funds. So 12 of the 31 won between $19 and $51 million, including $49 million to Wisconsin, so big deal. Yeah. If you were part of the application, I'm aware of how much work goes into it, so thank you. And Wendy is the Regional Innovation Officer, and Wendy, you dedicated your life to this for a few months.
Yeah, and there's a lot of people in the audience here that
Just to say,
we
raise your
all,
hand if you're part of that process, because there's a number of people here.
yeah, if anyone has done a grant, I would tell you it is, I think we ended up with about 800 pages and documents and so forth, so it was not an easy process. On the other hand, I'm also very happy that our government and all of our taxpayer dollars goes to that level of detail before they give someone $49 million, right? So you can kind of see it both ways. So it was a very grueling process. A lot of people in the room here, you see Jay and Kurt and Aaron and a lot of people that helped to write this proposal. Obviously, Idella and Mark, you'll hear about the workforce proposal, but anyway, it was really a great process to go through, and through that process, we had a lot of opportunities to collaborate with all of the companies that we'll talk about that process in a minute here. So.
Okay, so I'll talk a little bit about how the EDA chose a little bit about the 31 tech hubs that we designated, but I'll focus on how we chose the 12 to receive funding. But let me also say, when we're talking about either this tech hub or any of these tech hubs, we talk about consortia. So there were certain types of organizations that had to be part of these consortia: private sector representation, state and local government, nonprofits or an economic development administration, a labor organization or a workforce training organization, and higher ed. So these are sort of like the key ingredients of what makes any kind of tech hub, and they had to be represented, and then all sorts of other types of entities like national labs, for instance, could also have been partners. So in the designation, it was all about, okay, tell us what's already going on in your region, tell us why there's already momentum here. And then in phase 2, we asked for, like you alluded to, very detailed plans on how you're integrating with the private sector. So, let's not just make this like, okay, maybe your state government or something like wants to get funding and direct it towards an industry, and they're not even thinking about what the real market is here. And like, no, we want to make sure those market signals are integrated in. 2, tell us about not just how is this going to benefit your region, but how is this playing into a larger economic or national security effort. 3, what commitments are you crowding in? So, are you using this moment of the application and the competition to ask for dollars from other entities, or technical assistance, or policy changes at a university, or like all sorts of commitments that you can get to really maximize the impact of the potential federal funding. 4, tell us about how you're going to grow your workforce and create new opportunities for community members both at the PhD level on down to folks coming out of high school with a real focus on those without 4-year degrees. 5, tell us about what capital do you already have access to and where are there gaps? And maybe, where can you help fill those gaps for growing companies that might not have historically had access to capital? 6, equity and diversity. How are you ensuring that the benefits of the Tech Hub strategy accrue to all communities in your region, focus on communities that have historically been overlooked, and then also how are you including organizations that represent those communities in the decision-making process of the hub? And then finally, governance. In many cases, these consortia came together for this application, and kind of the idea of the program is like bring sort of strange bedfellows together, which means you want to have mechanisms in place for decision making and to evaluate progress over the next several years. Any ads?
I just, from a governance perspective, I think it's important that, this is over a five years for the funding and then 10 years to measure the results. So, technology changes a lot over that 5-year time period. So it is really important to have that governance piece because we do expect changes, right? New technologies will become available and new programs, new projects may present themselves. So to just have like a static one place in time, here's your 49 million and nothing's going to change, I think that would be probably the wrong way to think about this tech hub, right? So we've got the 49 million plus other funds, which I'll talk about, but there will be changes. So there's always opportunity to add new projects or change projects, and with the workforce project, I'm sure there'll be new jobs that'll become a target for us to hire into and so forth. And you just heard a great presentation on AI. So how do we encompass that more into our projects and programs? So yeah, we do expect changes, right? You guys expect changes too.
Absolutely.
Yeah. Okay, good.
We really hope that these consortia last beyond however long this program may last. Hopefully the program lasts long too. But that's a huge part of this is just that strategic coordination. All right, these are our 31 designated tech hubs. That is President Biden announcing the 31 tech hubs in October of last year. And then these are our 12 funded tech hubs. So you'll see Wisconsin there. And I'll just add a note about our portfolio. These are our critical technology areas. So we've got safe and effective autonomous systems, quantum tech hubs, biotech hubs focused on drugs and devices, other biotech hubs like Wisconsin focused on precision and prediction medicine, accelerating our energy transition, strengthening our critical mineral supply chain, semiconductor chip manufacturing, and advanced materials manufacturing. So you'll see, right, it's not just the coasts that are focusing on these technology areas, but cities across the country. And it's all hard tech, so you need hardware, you need equipment. In many cases, this is hard to get capital for. It's not just software that scales like crazy. So this is a really big effort at Commerce, and as you saw, the President announced it, so at the executive level as well. And I like to brag and say that Secretary Raimondo, Secretary of Commerce, says that she gets more calls about this program than any other program. So again, very, very cool that Wisconsin is one of very few that got funded here. Some stats on the types of partners that the hubs are partnering with. And then I love this slide, a reminder that these hubs represent real people on the ground doing very cool projects, from building drones in Tulsa for advanced weather sensing to building new quantum parks in Colorado for startups in quantum to share equipment and grow that industry. And we have lots of photos from yesterday. We did an excellent tour of Accuray. We went to the University of Wisconsin-Madison, so I'll update this slide with those. I have one more slide on other sorts of benefits that we're providing the hubs besides just the dollars, but maybe we can talk to that later on and hear about the different projects.
Sure. Great. Back to me.
Oh.
Great, thanks. So let's talk a little bit about what the Tech Hub is and maybe what it's not too. So when we think about the Tech Hub, first of all, I think the comments yesterday, for those of you that were here yesterday, they talk about, and Grace made this point too, is you have to start with an industry that is already, that's why we're all here, right? It's already a great industry in the state of Wisconsin, has great growth. So, and it's because of all of you that are in that industry that are making that happen. So the EDA did not want to start from nothing, right? And so, you know, you see all these numbers, and you will be getting also, you saw there's a QR code in your program, but you'll be getting this, I think, at lunch, right, Macy? Are they getting the Techonomy report? Okay, anyway, so this is a great, all these numbers will be updated. You can look in here in terms of how great our industry is doing. So I just make that point because, again, I want to thank all of you for starting such a great industry in Wisconsin and locating your companies here and the focus that all of you have in the industry. So really some great numbers here. And we just want to expand on that, right? So when we think about the EDA, it's all about economic development, it's about creating jobs, so it's about taking this and really growing that globally and being a global leader and being recognized as a global leader in biohealth. So let's talk a little bit about obviously the great companies. We have 18 different members in our consortium, and all of them have just, as Grace mentioned, there's different roles that each of these different companies plays. Some are more on the technology side, some are on economic development side, higher learning institutions. Obviously, we've got our clinical partners. I see Mara's in the back there, Kurt's over here, so we've got a lot of UW and MCW people. So we're very fortunate to have 2 medical schools in Wisconsin that have been very much engaged in this project. So you see the $49 million there. That was what we were awarded from the EDA. Which is great, but I don't want to sell this short because the other pieces up there were, in some ways, probably actually more difficult to get corporate commitments, to get the state commitments. The EDA was very grueling in terms of the application, but that all came as $49 million. The $32 million in corporate commitments means going around to all of the different companies, getting commitments, in-kind contributions. So that is just something that I want to point out, that our industry here in Wisconsin made that happen. So big thanks to all the companies that were able to help us there. And then $7.5 million from the state. So I am the farthest thing ever from a politician. I spent all my life in private industry. But getting the state bipartisan support in less than 6 weeks was phenomenal, and I don't know that that's been done before in terms of 6-week process to get $7.5 million from our state. So that was great, got that done, and then the consortium and the industry really just came through, so thanks to all of you that made that happen. So let's talk a little bit about the projects, and anyone in the audience that has questions, we can probably take those at the end too, but let's just talk about specifically what we're going to do, because I get asked a lot about the projects and people want to know a lot of details about the projects. We have to start somewhere, right? So we started with some very targeted projects, and that's one of the reasons that we were able to actually win the funding is when we turned in our proposal, it was very targeted. So it's targeted on oncology. So right now we're not working on Alzheimer's or heart disease or other things, right? We're really focused on oncology. And that really manifests itself in 3 different projects, technology projects, which I'll talk to just briefly. And sorry, I have to stand up here, it's more comfortable. So the technology projects, the first one is the Health Data Hub led by UW-Madison. And so we've got Kurt here, a lot of UW players. So that Health Data Hub, it's not just about getting the data into one repository. It's about creating a franchise that then that data will be available to startups and different businesses in the state of Wisconsin. And I'm just going to flip forward so that you can see the coverage. This is the Health Data Hub coverage. And if you had told me that we could get that type of coverage in the state of Wisconsin, remember this data is very valuable to companies. And so to get everyone to collaborate and share and give access to their data, which is a very valuable asset to these organizations, and it allows us to cover the whole state between MCW, Aurora, UW, and Marshfield Clinic. So You can see we still have some areas there. For those of you that might be from La Crosse, we still need to work on that area, but we'll work on that. And northern Wisconsin. But anyway, it gives us really great coverage for our state, and that was, as you heard, a really big part of the EDA is making sure that you have a wide variety of coverage throughout the state and that you have coverage for all of your different metropolitan areas as well as your rural areas. So I'll talk a little bit about how we're planning to do that with the projects, but I just wanted to flip to that slide so you can see that. So the Health Data Hub is a really big part of our project because, as many of you know, a lot of these projects are going to use that health data. The other projects are going to be dependent on using that health data. So we have to make sure that that data is a complete data set. We also have a great work by Dr. Amy Kind, who is at UW-Madison in terms of health disparities, which will be integrated into that data. So really good, complete data set. Next one is with CareScan mobile screening. So this is bringing mobile screening to the patient where they live, focused on making sure that we complete that data set. So these projects all work together. So MCW will be leading this project. When I talk about screening, a lot of you probably think about imaging, yes, imaging, but also laboratory test. So it puts that all together. So that's the first of its kind in terms of a model to bring that to patients. We'll be focusing primarily on Milwaukee as well as the tribal communities. So these are areas that are really currently underrepresented in screening. So a lot of times, because those populations are underrepresented in screening, they don't have access to clinical trials and different access to healthcare. So that's a big part of our program to make sure that our Health Data Hub has good robust data and personalized information on those populations, as well as just obviously improving the healthcare throughout our state. And then the third project is led by GE Healthcare, specifically around clinical image-guided therapies. So you heard a little bit, and I think you'll be hearing later today too, for those of you, there's a lot of conversation about theranostics, right? So that's a combination of therapy and diagnostics together. So we'll be expanding that. We've got Jay here from GE, so you can ask him all about it, but really exciting area. The growth of the theranostics procedures is expected to grow to 40% of oncology treatments within the next 10 years. So really exciting, groundbreaking new therapies. And the GE project is really working in conjunction with the other projects to make sure that we can select the right patients for those types of procedures. So the CareScan project, we get the patients in through screening. Health Data Hub helps us to gather the information for the right patients for those types of therapies, and then the GE project will help us to create demand for those theranostic procedures and put the right patient with the right treatment. So that project is very exciting, and like I said earlier, I'm sure that this field will be expanding rapidly over the 5 years that we're implementing this project. And then the other projects that we have going is one around the advancing the innovation, what are we calling it, lab to market? Yeah, it's in the circle here, advancing innovation to commercialization. So we've got Jessica here from Forward Biolab. So this is working with shared lab space as well as supporting our entrepreneurs. I'm sure there's several of you in the room here that are probably interested in that program. So we'll be building that out. Specifically, obviously, people are very familiar with the Forward Biolabs in Madison. We want to expand that type of concept to Milwaukee. So that's an exciting area that we'll be working on. And then I'm going to just punt a little bit on the last one because we've got Mark and Idella here who are going to talk in a lot of detail about our workforce project. So we'll talk about that next. But I just wanted to make sure that people know not only what we will be working on, but also, like I said, a lot of times we get questions, are you going to be working on this or that? And hopefully we will be able to add more projects as we go forward and hopefully get more funding. But those are our focus areas for right now. So I'm going to pass it to Mark and Idella to talk about the workforce project, and then we'll have time for some questions at the end on the project. So I'll give it to you guys.
Okay, so we didn't talk about this, but I'll go ahead because I'm looking around the room and I am curious, how many of you are here representing businesses or representing businesses in your communities and you're sort of wondering how this Tech Hub project is going to help you? Okay. How many of you are students or part of our sort of talent network and are curious about how this is going to help you move up and ahead in your careers here? Okay, this is really helpful. And then how many of you are represented sort of the education and training ecosystem? Okay, this is really helpful. So we have a lot of sort of business and sort of the EDO type of folks. I think that really helps me. You all are folks that we need some feedback from here today. So after this event, please email us, grab us, because this has been a real important component of what this workforce project is all about. So I'm going to sort of give you sort of the overall view of sort of how we got here, and then Mark will talk a little bit more about some of the details and the how-tos and the work that we're collaboratively doing together to sort of ferret out how we are the right kind of putting the right kinds of system tools, programs in place to meet the needs of the ecosystem. So I'm just going to skip ahead and my favorite triangle image. So some of you may know me from the world of SBIR, the Small Business Innovation Research ecosystem. I've worked with a lot of you. I've had the great pleasure of working with a lot of you as you're getting your businesses or you're growing sort of product development opportunities and looking at federal grants. And when this project came into being and I got an opportunity to be part of the whole designation process, I was like, this is great. It's like a grant on super steroids, and it was very exciting for me to be able to do. But I also have a passion platform about the biohealth space. I have a PhD in a bioscience from UW-Madison. I completed my degree a number of years ago, and I could not get a job at all in the biotech sector. And I had been working in labs since the age of 16. So figuring out how to navigate that space became sort of a curiosity for me. And I took a job and I worked as a recruiter for about 2.5 years, also working with our industry to understand how people thought about the right fit, the right skills that married up to the needs. Now the industry has definitely matured and grown a lot, as I see sort of just as the size of attendees since I was looking to make my way into the space. But I'm bringing a lot of that sort of knowledge as we went out to understand what were some of the critical gaps in the ecosystem that we could fill as part of workforce partnerships. And we actually arrived at this. So the last slide that I skipped on back was really to emphasize all of the different partners that came to the table to talk about really what were the needs that we needed to address as part of a grant opportunity. As you know, grants are about saying that we have a really strong foundation, but that there's a theory of change that we want to try to implement to make our ecosystem, address the problem from a new angle. And what I got an opportunity to do was interview a lot of our small businesses and also really engage with a lot of our workforce development partners, which is not an area of expertise that I have come to, that I had coming into this, but learned a lot about what some of the challenges they understood of working in this emerging space of biohealth and biotech sector. And this sort of represents our guardrails and our guidelines in the workforce project. We understand that we need to have a skilled workforce. And part of that skilled workforce is making sure that individuals have the right knowledge, the right work experiences, the right stackable credentials, so that they have a career and a career lattice that they can pursue as part of their work here in the Biotech Hub. And I'm going to go through each one of these pillars, but I want to just sort of leave it with, here's what we need from you when it comes to these pillars. So when it comes to the skilled workforce, one of the things that I learned as I interviewed a lot of people is we actually have a lot of these training programs. So I got to be an NSF engine reviewer for another community, and they were talking about this really cool program that they were able to stand up, and they had all of these new workers that were coming into their ecosystem every week, and so lots of people that could go through this training program. And when I look at our ecosystem, I'm like, oh, we already have those training programs. Madison College, MATC, the technical college, the universities, both the private and the private and the public institute. We already probably have a training program that will help get people into the space. It's the access, it's the knowledge, it's the widening of the aperture of what kinds of specific skills might be necessary to get a foothold and to grow. And that's what we need some iterative feedback from our ecosystem about, so that we know that we're building the right kinds of add-ons to existing programs to make sure that talent, all kinds of talent, are ready to get in and grow. The other thing we knew is we needed to have a diverse workforce. And diverse because we need to build trust in what the work looks like. So I heard some stories as I was doing interviews, and I could see this being true, where we have talent who have no idea what this sector is, but they see it as scary. We have clean rooms in our manufacturing, we have, the lab space that's sterile, and it can be pretty intimidating for those who aren't going through a lot of training to get a foothold in this industry. But we also are pursuing personalized medicine, which means we need all individuals who understand and who are part of the conversation. And so this is a really key pillar for us to make sure that we're reaching into communities across the whole state and making them aware, lowering sort of the fear and activation energy, and making sure we have a cadence of opportunities so that they really can experience what this sector has to offer in terms of employment and growth. And then probably the biggest opportunity is making sure we have some novel ways to engage our employers. So when you hear workforce, you may think, oh, we're looking at technicians. And we are looking at technicians. But in our communities that represent our biohealth sector, we have manufacturing, we have lab, we have the healthcare system that's part of this, we have construction that's part of this. We have to widen the aperture of who is a part of the biohealth sector. And that means we have to create these cadence of opportunities across all of you employers, all of you folks that have employers in your communities, so that we can share how people can navigate the lattice of opportunities that really exist in the biohealth space. One of the key challenges that we had in sort of putting together the designation is hearing from some of our Milwaukee counterparts, oh, well, that's not for us. We don't do biotech, that's all Madison. But man, the host of small businesses, manufacturers that are doing medical device manufacturing, that are working with some of you in this room to do the packaging and the sustainable packaging, to do the logistics and transportation, that's all biohealth. And so what we have a great opportunity to do is to think about what's the first way to get in and make sure that we have career opportunities, and this is a lot about what Mark can talk about. But what I am looking for is help us have an iterative conversation. Help us widen the aperture for individuals across all of our talent sector about what biohealth looks like, what career and employability looks like, and help us make sure that we're keeping true to some of the measurements and metrics that we want to show to EDA, that we want to show to the Biohealth Tech Hub about what we're able to do, because this is really an exciting opportunity. It's an exciting opportunity for all kinds of talent to see themselves in this space, but we need to have a dialogue with you on how to be able to do that. And so what Mark can talk about are some of the core pillars that are sort of our starting point to be able to do this. But part of what I get to do in my role is to think about some of the data, some of the metrics that we can measure what our success looks like, about our community involvement, and about our ability to look at talent. And then the last thing I want to say is that as I'm giving out these, doing these presentations, I often hear from businesses, you're only talking about the large businesses, right? We only have 300 people, you're not talking about us. No, we're definitely talking to you. You got 2 people, you got 1,000, you got 1,500. I don't care what you have. We need to talk to you because part of this is customizing solutions that meet the needs. And the other thing that I hear is, well, yeah, we need technicians, but what we really need is like software developers that understand our regulatory environment. We're talking to you too. What we really need are managers and CEOs. That's part of workforce too. So please help us have a dialogue so that we can really get all kinds of talent to meet the needs of the diverse sort of ecosystem that is this biohealth tech sector.
Yeah. I think I was feeding back. Thanks. Wendy talked about the governance and the importance of the governance structure around all these partners. And so when Idella's talking about the additional careers that have been identified or the careers that have been identified, we sort of talked through some of these slides and we'll make it more conversational to go through these ones. Idella talked about that. Where are we? Yeah, so we talk about some of the goals and outcomes. We won't dig into this because there's a lot of detail. Like Madison College is going to do this, Milwaukee Area Technical College is going to do this, Universities of Wisconsin are going to do this. But when we're talking about large numbers of new jobs, we have to understand what we're training for. And so some of the initial work that Idella was talking about through the consortium partners is identifying some of these initial more technical skilled careers. But then on top of it is sort of this network of experiences to expose people. And so when we think about career pathways, we think about the connection between the technical college and the university system, and we think about it as like a career highway, right, with on-ramps and off-ramps. And Idella mentioned stackable credentials. And so we want people able to come in and get a basic, let's say, lab tech credential from us, but then they don't waste their time and money on that because they can get off and they can get a job and get a good paying job directly into the workforce, and they can come back and build upon that and get a one-year diploma, and they can come back and build upon that and get an associate's degree, and then they can come back and take advantage of one of our 140 transfer pathways, right? So the technical colleges are the largest transfer in the world to the university system. Madison College transfers 700 students a year to the University of Wisconsin-Madison, largest transfer in the world to the University of Wisconsin-Madison. So what we need to do is work with employers and identify what are those packages of skills that they want their workforce to have, that they need their workforce to have, and how do we build upon them as people go down a career pathway. And so some of the initial occupations you can see here, and Idella made mention of some of these, thinking about electrical and electronic technicians, CNC programmers, so that advanced manufacturing. Idella was talking about folks that GE Healthcare, J-hires who are in an advanced manufacturing facility, folks at Accuray. And then, if you have to be able to manufacture, operate, and service that kind of machinery. And those are three different kinds of jobs, right? So something new, even since the start of this conversation, from having conversations with employers, and Wendy helped a lot with her background in medical equipment, thinking about, we're calling it BMed, biomedical equipment technician. What does that look like, right? We don't have that yet, but what we do have is a couple different programs that we can decouple and package them together as a new degree, right? So we have radiological technicians on the one hand who do imaging, MRIs, et cetera. And then on the other hand, we have electrical technicians who fix stuff, right? So we're pulling out skills from each of those programs and looking at creating a new apprenticeship program for a biomedical equipment technician, right? That's come out of this consortium. That awareness and the need for that, identified need by employers for that particular program came out. So I'll give you a second example. In the last 24 hours, so Madison College has a table down in the exhibit hall where we have our business and industry partners. So we do customized training. Maybe you heard me pitch that yesterday. We do customized training for industry, and we had two folks come to the table, both asking for a histology certificate, right? People who work with tissues, I can't explain it better than that, but most of you probably can, right? Not something we do, right? We have a biotech program, that's sort of a generic associate's degree, but they want to pull out the particular skills needed for a specific histology credential. And so I was like, well, Mike, you talk to the two of them and create a customized training program for them that may eventually turn into a credit program that is a smaller certificate that, again, leads to a biotech associate's degree, leads to a transfer to a bachelor's degree in sciences at UW. So this room, this summit is creating that, right? And it's doing it, based upon the partnerships that we've pulled together. So thinking about some of the other aspects that Idella was talking about. So we think about how we sort of start, and I said, let's not put the cart before horse, let's start with employer engagement, right? And Idella talked about how we started with those conversations to identify these occupations, but then further. So we start with that employer engagement. And there's a couple different pieces of the employer engagement, right? We talk about expanding programs. So I'll give you another example up here, radiologic technologists. So we heard from our partners at UW-Health and MCW, we need more radiological technologists. Well, Madison College only cranks out 25 of those a year, and Milwaukee Area Technical College also does about 25 a year. And they're like, we'll take 200, we'll take 300, we need more. So what are the barriers? What are the bottlenecks, right? So one is, what's the size of the funnel, right? So Right now, we can only give out 25-year because we're limited for the faculty we have and the facilities we have and some of the regulatory barriers that we have. So how can we work on those elements of the funnel itself, but then how do we work on the pipeline? So we're talking about a diverse workforce. Who's going to come into the funnel, right? And so we need to, at the same time, we can't just expand the funnel and say, great, now we can graduate more people. You have to have the career awareness. And raise your hand if you have a labor shortage and you own a business. We are at peak population, and so we have this almost existential labor shortage, right? And yet we have populations that are historically underserved who have low employment and low income. How do we solve that labor economics problem, right? This is what we're trying to do, is solve that labor economics problem, and it is a multivariate solution, right? So that's why we have all these different pieces. So how do we identify folks who might be interested and make them aware of career awareness, give them a career awareness that these are real and good paying jobs, and we'll get back to that phrase, good jobs. How do we understand what their unique needs may be though too, right? So what are the historic barriers to labor market participation and education and training participation? There's childcare issues, transportation issues. So how do we address those elements for what is a diverse, and when we say diverse workforce, we mean rural, tribal, low-income, urban, women, like who are the people who are not historically participating in the workforce? And so we're working with a couple different ways. Idella mentioned working with our workforce development boards. We're working with our K-12 systems to identify folks who might be able to come into a training program. What are their additional supports needed? And the Tech Hub is funding portions of that. They're funding through our workforce development boards some of that outreach effort, some of those coordinations with K-12, some youth apprenticeship opportunities. I was talking about some earn and learn opportunities. There's youth apprenticeships, there's registered apprenticeships, there's internships, there's part-time jobs, all kinds of opportunities for folks to make it more affordable, not just give people scholarships. That's fine, but there's only a limited number of scholarships in the world. How do you make it more affordable to people by providing them an opportunity to work and earn and learn at the same time? And so the design of the program contemplates that, and so we're working with employers to create those opportunities. Sorry, you want to jump in anything?
Well, I would just add on to that to say that it's, we've learned a lot about some of the hard skills, the technical skills that the ecosystem needs, and that's a lot of what sort of we've identified as that first low-hanging fruit. But we've also heard, because this is an ecosystem of entrepreneurs, because we are on the cutting edge of technology and product commercialization, because our manufacturers are on that cutting edge of advanced manufacturing and data-infused processes, we also need a host of soft skills. Strong critical thinking, who understand the rules and market factors around our ecosystem. And we need to infuse that strong entrepreneurial and critical thinking skills very early on in the process. And so one of the opportunities that this shared funding affords us is that each component of the partner can do sort of the thing that they do really, really well. And so the tech colleges get to work really well on the hard skills and the critical thinking components that are part of that skill training. What I get to do through my component of partnership at the UW, in addition to the data and the employer engagement, which are my favorite portions, we get to kind of play around with different programming that really infuses some of the things that we can do, that critical thinking, the entrepreneurial training. I'm looking at D2P over here. I'm looking at Kurt and some of the work that they do at UW-Madison. And make sure that there's a democratized access to that kind of training that we sometimes get as part of practicums and co-ops, entrepreneurial training if you do lean startup or design thinking type of stuff. So, and making sure that those skills that are experienced as part of that work-based learning are captured in micro-credentials, some kind of credentialing, so employers can see that there is some common set of skill and competencies that are part of that training. None of this could happen without this EDA funding to help us all come together, create the rules of engagement, define what some of the current opportunities are, and to envision what growth might need to look like. So, I mean, I can't say it enough. please keep talking to us and help us understand, because it is a hairy problem to sort of untangle.
Great, we lost our slides. That's okay. I guess we're okay. So, time for Q&A. Just before we do that, though, I just want to recognize a few people in a true spirit of collaboration for our Tech Hub. We have a lot of experts in the room here. So, Kurt, wave. UW-Madison, talk to Kurt about that. We've got Jay here. Jay, wave. GE Healthcare. We've got Aaron, Research Park. We've got Jessica, Forward Biolabs. Mara's in the back there, MCW. So. In the true spirit, I'm sure I've missed a lot of different people out there, but this is truly in this, thank you. In the spirit of collaboration, we've got, this was not done in a vacuum here, and thanks for Mark and Idella for really a great work on the workforce project. What they just shared with you, you saw some of the metrics. All of our projects have very detailed metrics, and so there's very specific things we have to accomplish in terms of workforce, in terms of economic development, in terms of technologies, right? So we've got Gantt charts, we've got all kinds of stuff. So that will all, if you're interested in that, that's all available. Like I said, we have 800 pages of documentation if you're interested. But so all this will be moving forward, and we're very excited. We just kicked off our project October 1st. So you guys are hearing it very early, so I don't have a lot to report yet. Next year at this time, we'll have a lot more to report in terms of what we've accomplished at that point, because if we can't do that, then the EDA is not going to fund us any more money. So we're going to have to do that. Yeah, that's all Grace's fault. So with that, I just want to make sure we have time for some questions. So there's mics up there. If anyone has any questions about the projects or any questions, we'll take any. Anyone? Great, thank you.
Employers in the room and those with businesses contact you to give you direct data on what they're seeking in employees?
Excellent question. So the question was, what's the best way to get a hold of, I would say, us as part of the workforce project? So we have emails on a slide. That's an obvious, easy way. Oh, a special plug. So I get to hire an employer engagement manager, and that job posting just came out last week, and BioForward sort of amplified that. That'll be, once that person is hired, that will be the best way to get in touch. So in the meantime, you can reach out to either one of us, and then we'll have a team in place soon.
Yeah, we didn't talk about the team. So the grant also funds a number of administrators, so to speak, to run this thing, because Idella and I have day jobs. And so there's a couple positions with Idella. There's some functional, like grant coordinator, finance person thing that we have to hire. And then we also have a compliance officer who's going to be in our shop at Madison College. And then the program director is going to actually be housed at Milwaukee area. We're both MATC, so I get stumbly on it. Milwaukee Area Technical College, as well as a Learning Navigator. So there'll be a team eventually that you can go to, but in the meanwhile, come to Idella and I directly, and we'll make sure to connect you with the right folks on the broader team. So we're happy to be the bottom of the funnel for that.
Yeah. And if there's any question on any of the projects, you can always go, if you go to the BioForward website, go to the Biohealth Tech Hub, all my information's there. You can contact me and I will get you to the right person. And I'm going to put two people on the spot before we go to the next question here. Off the governance project, overall the Tech Hub, we're hiring 3 people. We have 2 people here in the room. I'm going to put them on the spot. Chris. Yay. So
Hi, Chris.
Yeah, Chris Schiffner, but Chris Unterberger is our new project manager for the governance, and then we've got Jamie, wave. She's going to be our grant specialist. So I hesitated to point them out because they're brand spanking. They haven't even started yet. So if you're going to ask them questions, like I don't want to put them on the spot too much, but we're very excited to have them join us, and we're still looking for other roles too. So you'll hear, as part of the Tech Hub, all of the projects are kind of looking for either project managers or grants people or marketing communications. So there's different roles that you heard about, employer engagement roles. So just if you're interested, I know there's a lot of students and people in the room, so we are recruiting into the Tech Hub. So I just wanted to point that out.
And we've been a bit of a no wrong door, right? I mean, the strength of the partnership is like no wrong door to answer your question, frankly, right? Like, hit up Wendy, hit up me, hit up Idella. There is a strong enough partnership, and like as Wendy's pointing out, everybody in the room, like we know them too. So that's really one of the strengths of the partnership is you sort of can't knock on the wrong door.
Yeah. Go ahead.
Hi. Two-part questions. I'm confident the first will be easier. The slides and the metrics that you just spoke about, how can we gain access to the slides and the metrics? Will
Yeah,
they be
the-
available?
Yeah, so the metrics on all of the projects or
The Health Data Hub?
just the health data hub? So yes, so Kurt,
Okay. All right. Hey, Kurt. Steve Rotman.
I mean, I can get you the overall, I mean,
Okay.
depending on what kind of detail you want, but the health data hub will be run through UW-Madison, so
Great.
they have a lot more detail than probably if you're looking
I
to
know
suit your.
I know how to find Kurt. Thank you. Second two-part question. We've heard the past day and a half many times personalized medicine.
Mm-hmm.
Can you help define what that is and where the patient is at the center of the Biohealth Tech Hub collectively and specifically as you're talking about commercialization and personalized medicine?
Yeah,
Thanks.
great. I'll take a first cut at that. So when we were putting together a proposal, a lot of people talk about precision medicine, right? Which precision medicine is usually for a group of people, right? Personalized medicine is specific for that person. So when we talk about the Health Data Hub, it's gathering information for that specific person in terms of maybe it's where they live and their specific DNA and their specific genetic information, there's the area deprivation index for that person. So there's all of these different criteria that we collect, not for a group of people, which we call precision medicine, but personalized medicine, which is for that individual person, so we can get them to the right type of treatment. So that's kind of the high level question. And then when we think about theranostics, those doses are specific for that individual. It's not for all women with HER2 new positive breast cancer. It's for that individual woman that has that specific type of breast cancer is the difference. So that's how we define it. And that's what, I don't know, Jay, if you want to add anything to that, but the GE project obviously really working on kind of that image-guided therapy and getting the treatment, the theranostic, to that specific individual.
Sure, yeah. The dose amount, the exact therapy that's there, the response to the therapy also is very individualized. The patient's right in the middle of that, so how are they responding to that therapy and what adjustments need to be made, as well as adverse effects of a particular therapy. And how do you monitor for that and make sure that we're managing those aspects. So it really is, like when he says, you take precision medicine, well, the most precise type of precision medicine is personalized medicine, where you understand everything about history, genetic makeup, socioeconomic factors, environmental factors, and actually the disease itself, because the disease has a genetic makeup as well. So we're really excited about this being one of the first times that we as an industry have been able to bring that level of personalization to a therapy.
Please.
Great, hi. I think it's great to hear that you're looking to facilitate trainings for students and combine these different programs and funnel students that are traditionally underrepresented in roles like these in biohealth. My question has to do with retention. Is there going to be follow-up on, once you get these students with these trainings into these roles, are they staying in those roles and are they able to grow in those roles?
Short answer is absolutely. I mean, part of the challenge that we have because of the demographics is that if we're not retaining people, we are losing the workforce that we need to sort of fuel the growth of the hub. And so part of that is why we have this employer engagement manager. And then our partners also have sort of robust ways in which they look at retention post-training. So the short answer is yes. And the long answer is it's a great opportunity for us to learn how we're going to integrate data across all of our different partners to help tell that story.
A couple different things. So there's lots and lots of metrics and outcomes. Remember, we just pulled out a few on this slide, and we particularly pulled out the 1 year retention just to note that. But that's just 1 year, and we're talking about over time. And so I think you heard Grace or Wendy mentioned, so the grant's 5 years, but the reporting requirement is over 10 years, right? So we're being held to those outcomes over a 10-year period. So we're thinking about that retention piece. That's a critical piece for us. Thanks.
Yes, please.
I'm just curious about whether or not the BioHub is going to be, integrating with some of the existing efforts like Wisconsin or, the All of Us initiative to increase access to, population data for genomics or cancer screening and all that things. And kind of curious how this effort is going to play along with the existing efforts that have already been going on in the population.
Yeah, so we're kind of starting, I'll ask her to jump in here too if you have comments. But so as part of this grant, we had to start with somewhere, right? So the Wisconsin data set, so we really focused on that, bringing that information together, gathering as much as we can for Wisconsin. And then we want to, the end goal of the UW Health Data Hub project would be to kind of franchise that data, make it available for companies to use within the state, but then also adding outside of that. And we're also looking at working with other tech hubs. So you heard Grace talk about those, all of the applications. And believe it or not, a lot of those had a proposal for health data. And because of the issues with HIPAA and the way that we bring that data together, we were one of the only ones that got the health data project approved. So there were a lot of people, including places like Johns Hopkins, which, through COVID, they did a great job of amassing a lot of data. And they turned in a proposal for a tech hub around health data, and they did not win. We won that proposal because of the way we're structuring this and the way that it will be kind of an ongoing type of project that will incorporate the data in many different factors. And our lead project person, Jamal Matthew at UW-Madison, already has a lot of experience on the genetic side and getting all of that information together. So that's one of the reasons we won. But I just wanted to make that comment. Probably shouldn't, I'm not bad-mouthing other tech hubs, but it was really an interesting proposal that we thought, oh boy, we're against all of these research universities that put together these proposals for health data. And because of the way they did it, whether it was too complicated or IRBs from many different organizations that they had to try to bring together, our proposal was one of the only ones that was accepted. So we're trying to get all of them to come over to our type of proposal. So that's kind of the other thing we're trying to do, is work with these other tech hubs that did not get funded to bring them over to have the same type of system so we can make that kind of a national type of approach. But we have to start here first, which really gives Wisconsin a great advantage, I think, in terms of having that data here, hopefully attracting businesses to Wisconsin so they can use that data. I don't know if that answered your question directly. Kurt, anything else to add?
I would just add to that, reiterate what Wendy said, that, this is the starting point. We're already having multiple discussions just a month into this with the Veterans Administration, with tribal governments. The goal here is for this to be really a national model of inclusive data. So
Yeah, good question.
This will be expanding out.
Yeah. So did you have a question? Please.
Yes, my name is Xiu Juan. I work in the College of Engineering Office of Corporate Relations. And in my role, I work with our faculty and postdocs for the research collaboration with industry. And I'm asking this question on behalf of a PI who is funding his drug companies, drug startup companies. He's making a kind of chemicals that degrade cancer cells and proteins. So it's very deep tech startup company. He's looking for a place to fund his second company, this company. And I share with him, he said, oh, on the East Coast and the West Coast, it's easier to get funding. And I shared with him, I said, Madison, we have the Biohealth Tech Hub, just started. So he is wondering whether this tech hub would allocate some seed funding for deep tech drug delivery companies.
Mm-hmm. Yeah, so great question. We are not directly funding those companies. What we do have is we have access to different forums that the EDA puts together in terms of investment. Like, we actually have great exposure to different venture capital companies. They bring us into Washington where we can present our different companies that need funding. I would also refer him to Jessica, who's offered to help, Jessica Martin-Eckerle, wave there. So Forward Biolabs has been a great way to kind of get people engaged with that entrepreneurial community and different investment opportunities that she probably can help with. So that's where I would start with that. We know that Wisconsin doesn't always get our fair share of venture capital, so we are trying to change that. through different programs that we have. A lot of times what we've heard from small startups is they need help with quality and regulatory expertise too, so almost like consulting and experts that can help them in those areas. So part of our funding will go towards programs that will help specifically around how do you enter into the biohealth industry, because it is difficult if you want to, from a quality and regulatory standpoint. So those are some areas that we will be helping with, but we're not doing any direct funding for small companies. We're more connecting them with different opportunities.
I just want to add on to that, since this has been my space for so long. I think Wisconsin has a really interesting sort of entrepreneurial ecosystem. There's funding that's offered through WDC. My shop did a lot of support on helping companies go after small business innovation research funding. WDC provided match, still provides match for companies that receive that. We have dollars to help people buy consulting services. So it's grants that help companies buy consulting services. So when we say we don't have the funding, yes, that's true, but there's more nuance to the why. And part of the why is accessing the right kind of subject matter experts who can really talk you through the risks around different levels of commercialization, and then being able to use funding in a smart way to go through those levels. I'm not saying it's easy by any means, but what I wish we had is a little bit more of a nuanced conversation, and just the awareness that even on UW-Madison's campus, there's seed funding, WARF has their WARF accelerator, so there's some resources that are made available, and the challenge that we have is to make sure we're bringing the right kind of subject matter expertise to the right phase of that funding cycle to make sure people can use make the best use of the money that they have here. And I think that we have a really strong set of resources to be able to do that. I'd love to be able to have a chat with you about how to navigate what resources where.
Yeah. I would also add just to that point, because maybe I undersold that point. We have access to, as part of the sustainable funding, so the EDA and the Department of Commerce, and they have all these programs, right? And we got this list of, it was 582 different grant opportunities, and I'm like, wow. Sometimes people just don't know everything that's available out there. So we just had a bunch of proposals through the Build to Scale program, which part of being a tech hub means that you get extra points if a program can show how they're associated with biohealth in Wisconsin. So for example, if you apply for a Build to Scale grant, those are smaller grants up to $5 million, which is still a heck of a lot of money. But if you can show that you're in the biohealth industry in Wisconsin, you get 5 extra points out of the 50 as a benefit of being associated with the tech hub, which you don't get if you're in Illinois or Minneapolis or some other place. So there are opportunities like that which I can send to people, and these grant opportunities are available out there. So I just want to mention that too, because it was way more than I could even believe, that sometimes people just don't know about these opportunities. So.
Thank you, Wendy.
Mm-hmm.
Thank you so much.
Macy's pulling the plug on me. Okay,
Yeah.
thank you
Yeah.
all so much. I really appreciate it. Thank you.
Thank you. Awesome. Well, I hope everyone is able to walk away with something tangible. We're going to make our way downstairs to Hall A again for lunch and awards presentation. So